Mr. President, everyone knows that this Sunday is Mother's Day, a day when we honor our moms, our stepmoms, our mothers-in-law, our grandmothers, our wives, and all the women who chose to love, sacrifice, and care for a child. It's also a day when we celebrate new moms-to-be, and I'm happy to report to you that I'm just a few days away from having a new granddaughter, which I'm really excited about. There's a lot of excitement and happiness in our family, and it will be intensified come this Sunday, Mother's Day. My wife and I have 3 beautiful kids. We now have 5 wonderful grandchildren, with a 6th on the way. There is perhaps nothing more exciting than learning of a new addition to your family, and there's perhaps nothing more sobering than the state of maternal and infant health care in this great nation. I can think of no better way to celebrate and honor Mother's Day than to immediately commit on a bipartisan basis to enact change that will improve the health outcomes for new moms and babies nationwide. Too often in our country, new moms and infants, especially women and babies of color, are dying from completely preventable health complications. Listen to this. The United States is one of only 13 countries in the world where the maternal mortality rate is worse today than it was 25 years ago. Over the past 30 years, our maternal mortality rate has more than doubled. In the United States of America, with all of our hospitals and doctors and medical knowledge, nationwide, more than 700 women die every year as a result of pregnancy. More than 70,000 experience severe, near-fatal complications. In my home state of Illinois, 73 women die every year due to pregnancy-related complications. 70% of these deaths are preventable. These deaths impact women of color at significantly higher rates. Black women in the United States are 3 to 4 times more likely than white women to die as a result of pregnancy. In Illinois, African American women are 6 times more likely than white women to die of pregnancy-related complications. I had a press conference at the University of Chicago Hospital on this subject, and one of the presenters had done even deeper research than we had in preparation. And she reported to me something that really opened my eyes. This racial distinction bears no relation to poverty or education. An African American woman, well educated, from a family with resources, is still just as vulnerable as those in a lesser position economically when it comes to this racial disparity. Not only are we losing moms, we're losing babies. This is incredible. Currently, the United States ranks 32nd out of the 35 wealthiest nations when it comes to infant mortality. Every year, more than 23,000 infants die in this country, largely due to factors that in many cases could be prevented: birth defects, preterm birth, low birth weight, and maternal complications. And again, the African American community is impacted more severely. In the US, babies of color are twice as likely to die as white babies, a racial disparity that is greater than it was in the year 1850 in the United States. Something has to be done. I've joined with Congressman Robin Kelly of Illinois and my colleague and friend, Senator Tammy Duckworth, and we've introduced the appropriately named Mama's Act. First and foremost, our bill would expand the length of time that a new mom can keep her Medicaid health coverage. Currently, Medicaid only has to cover women for 2 months postpartum. Our bill expands it to a year. Given that 60% of maternal deaths occur in the weeks and months after delivery, it's imperative that new mothers be able to keep their health coverage longer. Next, the Mama's Act would improve access to doulas. Too often, disparities in maternal and infant mortality are rooted in structural racism in healthcare, meaning African American women often receive poorer quality care than white women simply because of the color of their skin. Black women are not often listened to or taken seriously by healthcare providers. Doulas can help provide education, advocacy, and support for women whose voices are being ignored. To this point, our bill would also improve implicit bias and cultural competency training among healthcare providers. Lastly, our bill would provide and improve hospital coordination and reporting on maternal health outcomes and ensure implementation of services to improve care. My bill is not the only one on the subject. Senator Kamala Harris has introduced a bill to help train medical providers to avoid racial bias. Senator Elizabeth Warren has suggested giving hospitals a financial bonus for successful health outcome improvements. Senator Cory Booker has a bill to improve access to primary care providers and doulas, and Senator Kirsten Gillibrand has a bill to provide states and hospitals with needed funding to develop and implement maternal safety best practices. There's no shortage of legislative ideas that would help improve maternal and infant health outcomes, and yet, unfortunately, we're not considering them. We changed the rules in the Senate a few weeks ago, and the Republican leader came to the floor and said, we need more time for legislation. Not much legislation going around the Senate in the last few weeks. Wouldn't it be nice if we had a good bipartisan bill that addresses this issue of maternal and infant mortality in time for Mother's Day? There's still time tomorrow for the leader, Senator McConnell, to call this measure to the floor, and I hope that he will. We have to make sure as well, and I'll close by saying this, that the Affordable Care Act continues to be a strong opportunity for people to have access to affordable, quality health care, and to make certain that the lawsuit that emanated from the state of Texas and is now working its way through the federal courts does not take away protection for Americans with pre-existing conditions. That continues to be a threat that we have to take seriously, and I yield the floor.